exercise. This is the best part. So, exercise, as I mentioned, is the only way to slow down the progression of Parkinson's. And neurologists are now actually telling people, take the Cinemet so that you can move, so that you can exercise. So that's awesome that we're now seeing more and more neurologists have that buy-in. And the earlier people start to exercise, the better to help slow down the trajectory of the disease. But it's never too late. It just becomes harder to engage folks. Because as the disease spreads, you'll see more and more symptoms. And particularly in a group setting for somebody who's had Parkinson's, like 15 to 20 years, who may be having some more cognitive involvement, who may be having some more impulse control issues, it makes it challenging in a group setting for sure. Again, the earlier the better. It can literally slow down the trajectory of a person's disease through neuroprotection. So you can tell your folks, you need to exercise to keep what you have. High intensity aerobic exercise, like you'll be doing with pedaling for Parkinson's, has been shown to increase BDNF and GDNF. You may have seen like articles about this floating around in the news. But these are neuroprotective factors. And these neurotrophic factors actually protect dopamine-producing cells. So if you're exercising high intensity, you're producing more BDNF and more GDNF, so less of the dopamine cells are dying off. So that's one of the reasons starting so early is really important, before that many cells are lost.
Is this a discussion they would be having with their PCP prior to coming to a class where, or their neurologist?
Specifically about the benefits of exercise?
Yeah.
Unfortunately, no, probably not. So most folks have about 15 minutes with their neurologist, to be honest. And it's kind of appalling. Like if I have a patient and they say, I had 30 minutes with my doctor today, that's a lot. And there's so many other complex things that the doctor's trying to medically manage. They don't have time to talk about this stuff. At best, they'll say, you should exercise. Or even better, they might say, the YMCA is now offering pedaling for Parkinson's, you should go to that. But for the most part, no, they just say you should exercise. So it's great. I mean, you guys obviously buy in. You know why exercise is medicine for all of us. But for this population, they just know it's good for them, and you actually telling them, like while they're cycling, like you're protecting your dopamine cells, and like giving them like those thoughts and really like getting that buy-in will help with them coming back to class time and time again. Because the more they can understand about it, they want to know about it. They definitely want that information. And I think it's really important that we all kind of provide that, because unfortunately. And then neuroplasticity. So our brains are plastic. Our brains can heal. Through exercise, we can actually create new nerve connections. Dendrites at the end of a neuron can grow, make new connections. I tell people nerves that fire together, wire together. So just saying things like that to people when they're exercising, like your nerve cells are growing, you're creating new pathways, your BDNF is really increasing right now. And it's so nerdy, but they laugh about it, and they actually really like it. Yeah, it really empowers them to take more control over their disease. So tell them those
I'm
things.
sorry,
Yeah.
how many times a week is it recommended that they exercise or take one of our classes?
They should exercise
Like
every
every
day.
day?
Can you define exercise though, is it minutes, is it intensity, or?
Yeah. Great question. So first of all, the best exercise that someone can do is the exercise that they will do. So I always tell people that. So like start with something that a person is really motivated with. So if a person loves cycling, perfect, get them in this class. But if a person hates cycling and they're going to come 1 to 2 times, it's probably not ideal for them. So they need to have other options. And studies have shown that exercise should be intense. So that's why they need us to be their dopamine and rev them up to get them to about a 7 out of 10 RPE.
Wow.
Intense, yeah. And I will say, and I know Laura will talk about this with like the protocol, like it's a lot of RPMs that you're trying to get people up to, and some people won't be able to do it right away, and that's okay. And you can just set that expectation right away at class and say, look, this is ideal, but it's okay if you don't get to it yet. A lot of people are just very deconditioned. Like these people, before they were even diagnosed with Parkinson's, were very sedentary. So we're just trying to get them up to some level of endurance. Yeah. So, but yeah, I mean, I tell people take your daily dose of exercise, just like you take your daily dose of cinnamon. It's just reality. I mean, it stinks, and it's not always like people aren't always capable of doing it, but it's ideal. So yeah, I tell people, like, once you're diagnosed with Parkinson's, it's like you're being diagnosed, or you're being promoted to being an Olympic athlete. Like, you need to exercise every day and really train, and you're training at the sport of beating Parkinson's. And yeah, but it can be so powerful and so effective. And once they start seeing that and seeing the changes, for the most part, people will keep on coming back. So people who exercise regularly also actually release more dopamine on response to exercise. So they are able to have more dopamine produced and use more of what's circulating in their body more efficiently. And one of the most awesome things I think about exercise and consistent exercise is most people need less medication over time. So we're slowing the progression of the disease through intensive exercise. So because people need less medications, they're more likely to have less side effects. And because they need less medication, it indicates, like, I can't say for sure, but it's indicative of their disease not progressing as quickly. Their symptoms are definitely not progressing as quickly. So brain-changing exercise, to go back to your question, like what kind of exercise? All exercise for people with Parkinson's is not created equal. So, you know, I've had people say, well, I exercise. I get up and I walk to the bathroom, and then I walk back to my recliner, and I do that like 5 or 6 times a day. That is not exercise. So it has to evoke perspiration. Like, these people should be sweating. They should be working hard. It should be hard to have a conversation. But we have to be careful at the same time, because a lot of these people have autonomic dysfunction, which I'll talk about in a minute. So a lot of these people have low blood pressure at baseline and are at risk for tanking out when they're exercising. So we have to push them, but also watch them and make sure that, you know, watch their coloring. And it's
kind of scary to be honest.
Yes, yes, it is.
yeah, a little bit.
Out.
People do know their bodies, and yeah, that's true.
100 miles an hour. I'm like, oh, you're telling me to do this. They're going to be like, okay, girl.
You're completely right. Yeah. And tell them that. Like, listen, I'm your instructor. My role is to push you and encourage you and get you to get your butt moving. But if it's too much, you're the only person that knows your body, and that's fine.
But they'll need medical clearance, right, Laura, before they even do this?
Yeah.
Okay. For
Yeah.
sure. Yeah, they would have to have it.
Yeah, definitely. So, and then brain-changing exercise is consistent, it's habitual, it should not be sporadic, it should be something that's scheduled into their week, into their day as much as possible. And it should be meaningful. So if you can, try to connect what you're doing to what matters to them most in life. So try to get to know these people a little bit. They are usually awesome people who have great stories to tell. So if you can figure out what drives them as an individual, like if they have a grandchild they're going to go see and they want to be able to get out